In this presentation, I will talk about my past practice, my present practice, and where I hope to go in the future. But first, it is important to understand a little of myself. I was brought up in a family where science was important and art did not form part of my education. And in 1982, found myself sailing in HMS Invincible to the South Atlantic and the Falklands War. There, my photography took on a scientific view, merely recording events and not taking any account of the aesthetic. It was on our return to the United Kingdom 6 months later that I realized what I had missed and how important it would have been to have recorded the emotions of that war. And so to the present. Pierre Bourdieu said, "Analog photographs were mostly made at occasions of family festivities, anniversaries, weddings, honeymoon trips, of babies and children, and alongside other notable events. It belongs to a family function, where the images serve to reinforce the family group." And that is what I have indeed been doing, taking photographs of family, pretty scenes in our vicinity, as special features locally, such as the famous Southwest Coastal Path. I have worked with Newquay Airport to help them develop a portfolio of photographs. And I have taken photographs of local establishments from interesting angles. But over the last year, I have been paying more attention to the aesthetic and the content. I have played with light to enhance family photographs. I have taken photographs of famous, for instance, statues from differing vantage points from the usual. And I have played with movement, and in this particular picture, showing the frenetic activity trying to get the backstage of a theatre ready for production. I have experimented with different techniques to achieve different results. And then I begin to develop my awareness of content, and in this case, new growth rising above the dead towards the sky. I have looked at our modern environment and how it is that we are always being watched. And I have represented the colours, the sound, and the blur of the commute on the underground. I have, though, also captured the amusing and the bizarre. And so what of the future? In terms of the future, I am looking to create a collaboration between the arts of medicine and photography, as well as a collaboration between myself and my patients. I'm looking to create a piece of work which involves the full participation of my patients, working together to produce a piece of work which can be useful and indeed powerful for a wide audience. I have begun to develop very definite plans and principally driving towards the development of a collaboration between the arts of medicine and the arts of photography. I will be working with patients directly, with them fully participating in the process. However, there are dangers. As Susan Sontag said on photography, to take a photograph is to participate in another person's or thing's mortality, vulnerability, mutability. All photographs testify to time's relentless melt. But also what Robert Frank stated, that there is one thing the photograph must contain, the humanity of the moment. And of course, nothing is more important when working with people with mental health issues. Returning, though, to the dangers, and again, as Susan Sontag has said, there is something predatory in the act of taking a picture. To photograph people is to violate them, by seeing them as they never see themselves, by having knowledge of them that they can never have. It turns people into objects that can be symbolically possessed. This does give rise to ethical as well as professional issues when working with patients as a clinician. However, these issues can have also directed how I will be approaching this matter and subject. I have begun to experiment with the use of metaphors. In this particular case, I took a photograph in response to a patient's quote, which was essentially, "To me, the outside sometimes seems inside. The inside then seems outside. I'm confused. I do not know where to go." Or in this particular case, where the patient said to me, "Sometimes I go to the floor 40 and I look out of the window. All I want to do is jump, but the window will not open." By shooting through a perforated blind, I was able to represent the turmoil of their distress. Dorothea Lange stated that the camera is an instrument that teaches people how to see without a camera. That is important for professionals, but equally it is important for patients. In addition to the metaphors, I have begun to take photographs of patients, of course with their permission and consent, to represent the difficulties that they have and continue to face. In this first picture, I am representing an individual who appears frenetic at the sink in the paint shop. He suffers from ADHD and high levels of clinical anxiety. And so I have begun to extend my photography further. Here we see, again, a frenetic individual working at the sink in the paint shop. He is someone with high levels of clinical anxiety and a good degree of ADHD. Then in this case, the representation of someone who has struggled with depression, as well as issues around his sexuality and uncertainty over the future. He is a great thinker, and that is what is shown here. And so bringing this all together, what I am doing is giving my patients their own cameras to record people, places, things, themselves, and so on, and which have been so important to them in their journey through the difficulties of mental health. They will then be able to tell their own story, and which will become part of the work. Then working with myself to create photographic representations of the difficulties that they have experienced. This is powerful and empowering to the patient. Roland Barthes said, "In each photograph is read as the private appearance of its referent. The age of photography corresponds precisely to the explosion of the private into the public, or rather into the creation of a new social value, which is the publicity of the private. The private is confirmed as such publicly." And this is exactly what my patients want to take part in. They want to tell others about their journey, and they want to celebrate their success. They want their experience to help others in distress. Ultimately, I would hope that this results in a piece of work and a publication which can be reviewed by a wide audience and will inform